I am Andrew Trees, one of the co-founders and CEO of Agathos. Agathos partners with hospitals and hospital physicians to reduce unnecessary variation in care, improving patient outcomes and lowering hospital costs.
Our company is focused on helping hospital physicians in particular get value out of the data they put into the electronic health record. We have a desktop and a mobile application, and we help to engage physicians, and then we help to improve clinical behaviors that lead to these better outcomes and lower costs.
One of our key innovations is the ability to automate the delivery of personalized, actionable insights specific to their practice patterns. And these come to them. They don't have to go to the application, which is a very important distinction.
This is empowering for physicians, and our technology can really make things better, faster, and cheaper for hospitals.
All right, can I get a quick show of hands for everybody who's super passionate about health analytics? I see that hand. All right, so let's talk about basketball. Imagine coach going up to Harden, telling him, you should make more baskets. Or imagine a school administrator telling a struggling teacher, just get those test scores up. Imagine telling a hospitalist, reduce your length of stay. This isn't feedback. Good feedback is immediate, specific, and actionable. But for many reasons, this is very difficult in hospital medicine. Too often, hospital physicians receive imprecise evaluation on outcomes level metrics and receive little, if any, feedback on their practice patterns and decisions. The result is inefficient delivery of coaching and inefficient delivery of care. Reducing unwarranted variation in care is a shared goal for physicians and administrators, yet it is grueling work. And physicians still, at best, feel missed by current solutions. Health data are notoriously cumbersome, and inpatient medicine has a particular challenge of attribution. Agathos tackles these problems head on. Our ultimate goal is better outcomes, reduced length of stay, lower total cost of care, fewer readmissions. However, outcomes are largely driven by factors outside the physician's control. Agathos has automated and scaled the work it takes to isolate those factors and identify useful insights. A hospitalist receives a notification on their smart device, feedback on their daily lab orders, which has been algorithmically filtered as relevant for them. Using peer comparison and case examples, hospitals arrive at their own conclusions about what, if anything, to do, or how to approach their next shift differently. These insights represent dozens of potential insights that the hospitalist could receive on actions such as medications, imaging orders, consults, when and where to discharge the patient. Agathos also delivers outcomes metrics updated every night, however individualized, accounting for the unique factors that each physician control. Team leaders, meanwhile, receive the same transparency into individual user feedback. Agathos' value proposition for hospitals and hospital physicians is better individualized metrics, actionable feedback specific to individual practice patterns, and higher quality, lower cost care driven by physician-led behavior change. At our first customer, MDP, on average, 59% of physicians engaged with every insight. We already have 28% increase in early morning discharges, 15% lower length of stay, about 0.26 days in the last year, equating to over 5,000 bed days saved, and hundreds of averted unnecessary lab orders and counting. I am pleased to announce that we are partnered with CHI St. Luke's Health, the Woodlands Hospital, and are going live this July. And we have almost 24 other mid-range opportunities across academic and community systems around the country. After landing in the Epic hospitalist market, we will expand across service line, provider type, and other EHR systems. MGP's work with us was selected in the top 15 innovations at Hospital Medicine 2018. Our team is expert at data integration, health analytics, behavioral economics, having several colleagues of mine from Epic, and Dr. Michael Van Duren, who led pioneering variation reduction work with Sutter Health. And we are thrilled to welcome TMC Innovation into our team of digital health partners. Feedback is always challenging in complex disciplines, whether in sports or hospital medicine. Leaders will often say, we have a great team, and I know we can perform even better, but how? Agathos can demo with real data in weeks and prove behavior change and return on investment in months. We welcome introductions to hospital administrators on Epic systems who are interested in not just knowing where they can perform better, but also how. And if any of this resonates with you, then I look forward to speaking with you. My name is Andrew Trees, co-founder and CEO of Agathos, and together we are defining valuable care.